Well, I believe that the decision made by the LA County in terms of reinstituting masking indoors, even amongst vaccinated individuals, is appropriate because of the data. And the data show that not only is there an increase in the numbers of COVID-19 cases in terms of the positivity rates among those who get tested, but also, most importantly, also an increase in hospitalizations. I think it's very alarming that the pace of vaccination has slowed down everywhere in the United States, including in New York City, and many other parts of the world of the country. And of course, the pace of vaccination in other countries is minimal at this point in time, many parts of the world. So what can we do to increase the pace of vaccination? That's a challenge, and I believe there are really two ways we should go about this. Number one is to make it as easy as possible for people to get vaccinated. Take the vaccines to them rather than expecting them to come to the vaccines. Then number two is we need to work harder to try to overcome some of the lack of confidence in the vaccines, to overcome what has been called the vaccine hesitancy. And we need to do more outreach, disseminate accurate information, try to respond to some of the disinformation, misinformation out there. We need to do everything we can to counter this misinformation and disinformation, and to gain allies within communities, within all communities that are hesitant. We need to gain allies within them so that people realize that getting vaccinated is to protect themselves and to protect their families and their loved ones. I think we're also observing in New York City at the same time an increase in terms of numbers of cases, a slow blip, a tick up in the numbers of cases, and also in terms of the percent of people who are positive amongst those who get tested. But we have as of yet not seen an increase in hospitalizations or deaths. And I think that is the reason why up to this time, there is no such indoor masking mandate in New York City. There probably are many different reasons why vaccination rates are higher in the Northeast. I think one of them, without a doubt, is likely that the early disastrous and horrific impact of this pandemic on people living in this area. I'm sure that has had this memory of, and the trauma of that experience is very alive in people's minds.